Today we will be discussing the importance of choosing PT first for pain management with respect to second-party payers. Our presenters are Caroline Gordy, Hannah Harrison, Anna Myers, and Suzanne Sanders.
The use of long-term opioids to treat chronic non-malignant pain has increased over the past 20 years. Unfortunately, there are very few long-term studies that document the safety of long-term opioid use as treatment. Approximately 20 to 45% of the long-term users will tolerate the use of the opioids without significant side effects, which is good. However, that leaves 50% plus of users unaccounted for. How do long-term opioids impact them? Will they struggle with addiction, dependence, or harmful side effects? The real question is, how risky is it? The risks range from being considered annoying to life-threatening. The patient may experience side effects such as constipation, cognitive effects, tolerance and dependence, sleep disturbance, and addiction, all of which will impact the patient's quality of life. Opioid-induced constipation can lead to significant increase in patient morbidity and mortality. The risk of impaired cognition is as high as 62% in patients taking chronic or long-term opioids. There also has been found a prevalence of central sleep apnea in patients taking chronic opioids, and there is a 26% chance of long-term opioid users becoming opioid abusers.
How effective are opioids in improving outcomes in patients with chronic pain? One study showed that while there is mild to moderate improvement in acute low back pain, there is not sufficient evidence to support the benefits of long-term opioid treatment for chronic low back pain. In fact, when compared with non-pharmacological treatments, including physical therapy, long-term opioid use only minimally decreased pain and had little to no effect on the participant's ability to return to work. On top of this, despite a rise in prescription opioid use, according to the most recent statistics from the Social Security Administration, there has been a rise in the number of Americans on disability due to musculoskeletal diagnoses.
Opioids pose a huge economic burden in the United States, which results in consequences for patients, healthcare providers, commercial and government insurance payers, and the society in general. On average, chronic opioid users visit emergency rooms and doctors' offices twice as much as non-abusers. The cost of opioid users with private insurance is about $14,054 more than non-abusers. And the cost for government health care, like Medicaid, costs about $6,650 more than the non-abusers. Furthermore, government health care paid for addiction therapy treatment for at least 80% of their opioid user population, whereas private insurance companies supplemented 30% of their clients suffering from opioid abuse. Overall, insurance companies are dishing out a lot of money to help out this population.
A question you might be interested in is, how much does addiction therapy cost? Well, Ling revealed pharmacological treatment with the drug buprenorphine showed participants' success in opioid abstinence after a 12-month program, which is fantastic. However, another article showed that the cost for a 12-month time frame for a patient receiving pharmacological treatment for opioid dependency would cost a private party insurance payer $21,000 and a public insurance payer $14,600.
So although insurance companies are trying to combat the opioid epidemic, they are failing to apply evidence-based practice to discourage opioid overuse and encourage safer and more effective alternative treatments. Insurance companies can intervene by lowering the quantity limits, meaning lower the average 30-day supply to maybe a week or two, having prior authorization, where the prescriber must contact the insurer for pre-approval before writing a prescription the insurer will cover, and using step therapy, meaning start off with a less risky drug, such as NSAID. Currently, most insurance companies have about 74% of opioids listed in the cheapest category for medication, which is about $10 for a month's supply. Insurance companies are still heavily relying on opioids to help their clients and should transition their focus on physical therapy as a form of pain treatment.
We've talked about how effective opioids are in treating chronic pain. How effective is physical therapy in treating chronic pain? In a review of 60 randomized controlled trials, it was concluded that lower back pain patients who received physical therapy before other forms of treatment had a lower utilization rate of high-cost medical services than those who did not seek physical therapy first. The incidence of opioid use in this population that sought physical therapy first was also lower. Physical therapy in the form of exercise therapy, including aerobic exercise, strength training, and some passive interventions, can decrease pain, increase function, and increase the ability to return to work.
The take-home message here is that modifications should be made within the insurance contracts in order to provide more options for patients seeking treatment for their pain. These modifications can promote more conservative options where the patients may not be initially exposed to prescription opioids. Physical therapy should then be considered as a first-line intervention to treat this pain conservatively before opioids are needed, which will hopefully decrease any harmful long-term complications for the patient.